We've all heard of artificial tears, but what are they exactly? And how can you tell them apart? In this episode of OCuTALK, Dr. Amal Mansoor will be telling us all about artificial tears, when we should be using them, and which kinds to use, based on the patient's symptoms. Dr. Mansoor?
I want to talk to you.
Not now, later.
No, now.
My name's Nick, and today we have a very special guest joining us. Please welcome Dr. Hello, everyone, and thank you for joining us for a brand new episode of OCuTALK. My name's Nick, and today we have a very special guest joining us. Everyone, please welcome Dr. Amal Mansoor. Dr. Mansoor, thank you so much for joining us today.
Yeah.
Well, thank you again for joining us. We know you're very busy, so we wanted just to kind of introduce you first. So if you have a minute, do you mind just introducing yourself to our audience, letting them know a little bit about your background and your specialty?
Hi, everyone. My name is Dr. Amal Mansoor. I'm an optometrist that graduated from MCPHS University in 2019. I was previously working in Canada, Toronto, for almost 3 years, and I just recently moved to California. So I'm actually studying for my legislative exam and soon will be working here very soon.
Well, excellent introduction. Thank you again for joining us today, Doctor. So before we get into our discussion, our discussion today actually is going to be about talking about artificial tears. And so before we get going into anything, I was hoping you could let our viewers know what are artificial tears?
Yeah, so artificial tears are eye drops that help lubricate the eye, and they coat the outer layer of the eye and keep it nice and moisturized.
Oh, perfect. And so along with that, what do they do exactly? Can you kind of explain how they work?
Yeah, so artificial tears work by creating they create basically a coating that mimics the natural tear film. And this basically helps stabilize your tear film and also thickens the tear film as well.
Oh, perfect. And when would you recommend artificial tears to your patients?
Well, I recommend it to basically anyone that is suffering from dry eyes. So this could be somebody that's working from home using a lot of screen time, or also somebody that has a medical condition that may be causing a lot of dry eye symptoms as well.
Perfect. Excellent information there, Doctor. And so what are like the key ingredients in artificial tears? Could you go into that for a little bit for us?
So artificial tears has 2 active ingredients. This is called demulcents and also emollients. So examples of demulcents would be things like carboxymethylcellulose, propylene glycol, and also glycerin. These increase the viscosity in the tears. Examples of emulsion would be mineral oil, and this increases the lipid layer of the tears. So it helps stabilize the tear film.
Well, excellent information, Dr. Mansoor. And so I know a lot of like we see commercials about like artificial tears or kind of like redness reducing eye drops that we see them all over the place. So is there like a difference between the two? And like are artificial tears and redness reducing eye drops, are they the same thing?
So actually, artificial tears and redness reducing eye drops are not the same thing. Artificial tears are essentially over-the-counter products that help lubricate the eye, so when your eye is dry. Whereas redness reducing drops, they're also over-the-counter. However, they tighten the blood vessels in the eye to help reduce redness. So we actually don't recommend this for long-term use because it can cause complications.
Oh, perfect information there. And I also just had another question about, what's the difference between preservative-free tears and tears that have preservatives? Can you distinguish between the two and let our audience know about that?
Sure. So preservative artificial tears are different than preservative tears in that preservative tears have additives. Additives are essentially products that help decrease the bacterial growth that happens.
Well, perfect. Excellent information there, Doctor. And so is there one that's preferable to the other? Have you seen patients who say like, I love these preservative-free artificial tears, or I love these, these drops that have preservatives in them, or like, is there one that over the other that you've heard a lot about, or what do you hear a lot in your office?
Yeah, so it really depends on the patient. for preservative-free artificial tears, we usually recommend it for patients that are using artificial tears multiple times a day. And that's because it comes in a single vial. So after you're done using it, you can just discard it and it doesn't have additives in it. Whereas preservative artificial tears comes in a bottle and you reuse that same bottle. So we have to add the additives. And these additives, again, help stop the bacterial growth that happens inside the bottles. So it really is cheaper, the regular bottles, but it also comes with a little bit of preservatives, whereas the preservative-free don't. So really depends on the patient.
Well, excellent information there, doctor. And so is there anything that you kind of recommend in conjunction with these artificial tears when it comes to like, dry eye symptoms that you see in your office?
Yeah, so I love to also recommend using the 20-20-20 rule, which is every 20 minutes, look far away for 20 seconds at 20 feet. This really helps patients remember to blink more often. I also recommend lid wipes and warm compresses in addition to dry eye symptoms to help out with that.
Well, fantastic recommendations there, doctor. And so how do you select the right artificial tears, or how do you like kind of direct someone over to choose the right artificial tear when there's like so many options out there? Like what should your patients be looking out for?
So I always recommend that patients actually come visit your optometrist before looking for artificial tears. And that's because there are so many different types of artificial tears because actually the eye tear film has three layers. It is the inner mucin layer, the aqueous layer, and the lipid layer. So without actually knowing what type of artificial tears will help treat you, you actually probably should see your optometrist to help determine and effectively choose the proper artificial tear that works.
Excellent information, Dr. Mansoor. Thank you for that. And are there any alternatives to artificial tears that patients can use?
So, artificial tears are definitely really beneficial. One easy thing I always recommend to patients is actually to remember to blink yourself. So, frequent blinking actually releases your natural tears. So, every time you blink, it releases the tears, and that actually will help you along with the artificial tears. So, I recommend that too.
Fantastic. And when it comes to artificial tears or anything, are there like new technologies or developments that are on the horizon right now in eye care that we should probably be on the lookout for?
Yeah, so new technologies that we're currently seeing are things like low level light therapy and also intense pulse light. These essentially heat up the meibomian glands that help increase the lipid in the tear films. A lot of people currently are using that along with artificial tears to kind of help the flow of your natural tears to come out. So, in addition to artificial tears, that's really great too.
Oh, fantastic. And before we leave today, was there anything else that you'd like to let our audience know about?
So I just wanted to share that dry eye is a really important topic, especially in this generation when we're using a lot of screen time and everyone's working from home. It's estimated that almost 15% of the population has dry eye. So it's really important for patients to come get your eyes tested and check out what type of dry eye that you are currently have so that you actually choose the appropriate artificial tear that helps your symptoms.
That was fantastic information there, Dr. Mansoor. Everyone, that was Dr. Amal Mansoor. Dr. Mansoor, thank you so much for joining us today.
Thank you so much for your time.